All right, Rest Never Sleeps podcast, day 2. Last interview of the day with Maneesh Goyal from the Mayo Clinic Platform.
Yeah, welcome.
How are you, Maneesh?
Doing great. It's Vegas, so you have to be on.
You got to be on, Vegas, all the time, 24/7.
Yeah.
What's new with you?
Yeah. So what's new with us? Boy, first of all, this conference, it seems to get bigger and bigger every year. For us, we're excited to meet with all the great companies, innovators that are here. And but I'll tell you this. It's been 5 years on this journey with Mayo Clinic Platform. The first year we had to just define what platform was.
Right.
Everybody uses that term. Second year was around really defining our product strategies. Third year was building. Last year was market testing. And this year we're starting to actually have clinical use cases that are showing Mayo Clinic, an organization that's doing high quality care for 160 years, changing its practice. Using data to rethink how we're there's no better calling. I often say to my wife, I'm a kid in a candy store. We're affecting millions of lives. So that's what's up.
That's so exciting too, because the Mayo platform and the data set is so robust.
Yeah.
What are some of the early outcomes you're starting to see?
So I'll give you an example. 9 months ago, we hired a neuro-oncologist. He's a sub-specialist on glioblastoma. Glioblastoma at Mayo Clinic has an 18% survival rate.
Oh, wow.
We see a really complex patient, so it's a horrible disease that not many cures. She knew anecdotally that certain kinds of patients have better outcome, and wasn't able to prove it, right?
Yeah.
So we gave her access. Within a week of being at Mayo Clinic, she was able to show that patients that had a particular type of anti-epileptic medication had 31% survival rate versus 18% survival rate.
Almost double.
So
wow, it's incredible.
Nothing I just said has anything to do with AI or agentic or pick the word du jour. It's just pure analytics.
Yeah.
So we said, great. Now, is that interesting correlation or is it actually causal?
Right.
So we're now in a clinical trial. So by next year, we'll have a analysis to say, do we have an answer to patients that are suffering from this horrible disease? Now it gets better. So she said, okay, now what other correlations can we find? And she said, one of the first things that happens when you have a cancer diagnosis, all the other diseases that you're dealing with are out the window. So if you have diabetes or high cholesterol, you just stop paying attention to those because you're dealing with this traumatic thing.
Right.
So she took all the information on hundreds of thousands of patients that we've seen that have a cancer diagnosis and figured out that if you remove all of diabetic patients or obese patients, you basically show that if you manage their A1C, so patients that manage their A1C had it somewhere between 5 and 15% better survival rate, which makes sense.
Yeah.
If you have a lot of free sugar floating around in your blood, cancer feeds on that. So if you have to starve it, it reduces the mortality rate of patients.
Interesting.
So we changed our practice of medicine at Mayo Clinic overnight.
Based on that data set.
Yeah, based on that data set.
Incredible.
So a narrow example, but a massive impact.
A massive impact, yeah. And you think you probably, if you do tie it to causation, I mean, you probably have a much better set of outcomes and data set that you can predict even greater into the future.
Well, so let's talk about causation, because where you're going to is clinical trials.
Yes.
Okay, clinical trials do what? They observational studies are typically you track a patient and you track a bunch of measurements. But what if you could do all observational studies using retrospective data? You don't have to spend years doing studies. You can actually go
back to the data set you already have, go back in time.
Yeah, you can.
Wow, that's powerful.
And so now what we're doing is actually looking at all the clinical trials that were run and seeing if we can reproduce them. And it's statistically relevant.
Yeah.
And more importantly, we're now asking the question, having the data tell us interesting correlations.
Yeah.
So think about, trials are about testing a hypothesis. Now the data can actually spit out a hypothesis for you, and you can assess whether it's valid or not. So
What are some of the things you've seen here that kind of give you pause or blow your mind a little in terms of innovation?
So, I think that's a great question. I've been so focused on us, right? I should actually know the answer to that. I think where we're headed is if you have clinical data and you have molecular data and all these models, you could have. I was talking to one company where you could say, create a molecule that addresses this particular thing, and it will actually construct the molecule.
Wow.
So if you think about that in biopharma, okay, now you don't have to spend time doing iteration.
That's incredible. Yeah.
Edison, the famous thing, Edison had like hundreds of experiments to get to a light bulb. Well, you don't need to do that. You just say, give me the molecule.
Interesting.
So what does that mean for pharma and the therapeutics?
Faster time to market.
Actually, I'd go one step further. It means that we can create a vector on Ed, and we could say, Ed needs this, and we can actually design a drug specifically for you.
Wow.
That's where we're headed.
Wow.
Not that far away. Right?
Individually designed drugs based on body type, based on chemistry.
Why not?
Incredible.
Why not? I mean, it's that. I think we'll see that in our lifetime.
Yeah. That's terrific. Any other insights from the show this week?
Yeah, I would say it's interesting. I think their evolution of this conference went from a bit of a kid, party animal-ish to feels real.
Yeah, like really business-oriented,
it's
business
really
focused.
business and real outcomes, and you're starting to see successes of companies. The open evidences, the bridges that are starting
AI
to
is everywhere.
And I think they're real problems that they're solving.
Right.
And I think that's real critical because it's not pie in the sky with no business model. It's actually really nuanced and layered understanding. So I'm excited about that.
I'm excited too. Ed Gaudet, Risk Never Cease podcast, and we're out.